Hey everybody, welcome back to the Teach Back method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we're going to be discussing another shoulder pathology, labral tears. Let's break it down. As you can see, I already have a lot of stuff written up here. Unfortunately, my previous draft did not save, so I'm starting from the beginning. So we're talking about labral tears. This falls under the classification of the hypermobile or unstable shoulder. Remember, there are 4 different classifications for shoulder pathologies. This is just one of them. Now, for labral tears, there are 2 main types. We have our slap tear and Bakark lesion. Now, what's the difference between the two? It actually has to do with the position on the labrum. So, this is our labrum. Enjoy my beautiful drawing. So the slap tear occurs between what we would call 10 o'clock and 2 o'clock. Look at it as a clock. So we have between 10 and 2. So anything that happens in here is considered a slap lesion. And remember, slap stands for superior labrum anterior posterior. Bakark lesion occurs in a different location. So it actually occurs between 3 o'clock and 7 o'clock. So more in this area. The next 2 things I'm going to discuss are the subjective and objective findings. Remember, subjective is what our patient is reporting to us, and our objective is what we as the physical therapist find during our evaluation. So, for labral tears, our patient's going to come in and they're going to report a traumatic onset, such as a fall on an outstretched hand or perhaps catching a very heavy object. Next, they're going to report pain and instability with overhead activities. And lastly, they might report a clicking or popping within that shoulder. Now, objective findings, we're going to find a couple things in our evaluation, one of which is being limited range of motion and medial muscle tests. This is pretty common after a injury and we are not using it anymore, a lot of disuse in that shoulder. So we're going to see a limited range of motion in comparison to the unaffected side, as well as weaker muscles with our manual muscle test in comparison to the unaffected side. Additionally, we may or may not see a limitation in the posterior capsule that can be taken or leaving. That's not going to be in every single case. And lastly, we're going to do some special tests to help determine if it is in fact a labral tear. So remember, there are quite a few special tests that we can do for a labral tear. We have our O'Brien's test, our anterior slide test, our biceps load test, our crank test, and the clunk test. The last thing I would like to talk about are the interventions that we would do for these patients. So, as we would expect, we are going to address all the things that we found in our objective finding. So with those limitations in range of motion, we're going to improve the range of motion in that affected shoulder. Additionally, with those limitations in the manual muscle test, we are going to be doing some strengthening activities to improve the strength in that shoulder. If we do find that limitation in the posterior capsule, we are going to address that, maybe with some joint mobs. And lastly, surgery. Would this patient require surgery or not? It is a case-by-case basis, and if we do have a severe labral tear, this patient would require surgery. I hope you guys learned something today about labral tears. Come back to my page to learn more.